if after a baby come out, neck, you can put it back.
You can...
Really, that's it.
No lah.
Dr. Tony, why didn't you choose to do like children also?
Children is too difficult. Children is too difficult. You have to manage two things. You manage the child and you manage the parents.
Alright everybody, welcome back into another episode of Doctor
Say One Horh.
Ladies and gentlemen, today we have with us Dr. Lam Kai Yet. Is that her name? Lam Kai Yet? Wow, Dr. Tony.
Yeah.
His name sounds pretty cool, yeah?
Yeah.
Lam Kai Yet.
Guy.
Oh, cool guy. So what do you do and what do they call you?
So I work as a pediatric orthopedics doctor.
Pediatric?
Yep. I'm trained in orthopedics, but I subspecialize in pediatric, anything in children.
Pediatric sounds like dieting. Like you do dietitian or what?
No. So I'm an orthopedic surgeon. I deal with children's bones, but just focus on children.
Oh, as in like you do all the bones in children only.
Absolutely.
So in example, adult like Dr. Tony that you cannot deal with him.
I'm trained to see adults, but I think at some point we need to focus on certain subsets, further develop the subspecialty. Yeah.
Right, Dr. Tony, why didn't you choose to do like children also?
Children is too difficult. Children is too difficult. You have to manage two things. You manage the child and you manage the parents.
No way, doctor.
Yeah.
You have like so many kids.
Yeah, but that's different.
My further subspecialty actually is in limb deformity
Limb deformity.
and limb lengthening.
So it means that what kind of deformity are you talking about?
Congenital, post-traumatic, post-infectious.
Wow, that's very cheap, doctor. I mean, congenital, like
Congenital, they're born with it, so they're born with the problem.
oh,
Yeah.
okay, born with a problem
Or post-traumatic means after an injury.
when they're a baby.
Yeah, when they're young. They're small.
Okay.
Or post-infectious means they had a bad infection.
So you mean you can solve this kind of stuff?
Yeah, absolutely. Yeah.
You know, Dr. Tony, you know my father, right?
Yeah.
You know my dad, right?
Yes.
You know, when he was a baby, actually, it was said that when he was born out of his mom's womb, doctor pulled it out wrongly.
Really?
And so since he was born, right, he had like a neck, like that. A bit of a neck, what do you call like a deformity a little bit, right?
Torticollis. Yeah.
Torticollis.
Torticollis.
That's a name for it.
Yes.
Torticollis.
Should have seen Dr. Lam Kai Yat.
So actually, like can you solve that?
Most can be treated quite easily. Yeah.
So it means if after a baby come out, neck, you can put it back.
You can...
Really, that's it.
No lah.
You need to stretch. You need to stretch.
Then now how? If now already adult already, then
If
already.
it's fixed for too long, then of course everything tightens in that manner. But it's a bit harder to deal with. Yeah.
But can still be solved.
I think it still can be solved. Yeah.
Oh.
To some extent. Not fully.
Okay. Anyways, guys,
Anyway.
let's get it rolling. What is feet deformity for kids?
Feet deformity in kids basically is anything that looks weird in the child's feet.
Okay.
But you must understand that children's feet are developing. So
Yes.
not everything that looks like a deformity is an actual deformity.
Okay.
It could very much be physiological, part and parcel of growing up.
So what kind of feet deformities is that commonly observed by you or by the general public?
Okay, so the common ones would be flat feet,
Flat feet, okay.
overpronation or underpronation.
Overpronation,
Overpronation makes the feet look flat.
right. And
Okay, underpronation means they have very high arches.
but these should are deformities.
They're all-
But so what is normal? What is a non-deformed one?
so everybody's foot actually has a arch.
Yes, and yes.
So if the arch is not there, I mean it's missing,
Yes.
then it's a flat foot. We call it
Okay.
flat foot.
Okay.
But if the arch is too pronounced, that's when they say you are
You're-
underpronated.
Underpronated, okay.
I also see patients, children with foot deformity.
Okay.
But I think most of them are not serious.
Right.
The deformity is outgrown.
Right.
For example, is flat feet.
Okay.
So most children will outgrow this deformity by the age of 5. Is that correct?
About 7, yeah.
About 7. Okay.
Outgrow as in
Outgrow,
like
they will become form the
okay.
art again.
Okay.
Initially flat.
Okay.
Then by the age of 7, before the age of 7, I form the art.
Okay.
Like normal adult.
Okay.
Then
cool.
my question, what do you do if by the age of, after the age of 7, the foot is still flat?
Okay, so I think
right.
everything starts with an initial assessment, right?
Okay,
You have
yeah.
to look at the child. Important for flat feet is to determine whether the child has any symptoms, most of all. Yeah, symptoms, we mean, is there any pain in the middle side of the foot? Do they have aching sensation when they walk for too long? Is there any parts of the foot itself that has thickened skin?
Thickened skin.
Yeah, that's right.
So
So,
it
so,
can
so if your
sit-
foot is deformed too badly, the position is not great,
Okay.
it can cause the skin to be thickened at areas where it's not supposed to be. being-
Okay. Cool.
Then anything else?
Yeah, that's right. So I think the assessment of anybody with a flat foot will be whether this is a flexible or rigid problem. If the feet are flexible, that means when they tiptoe or when you do a certain stretch test, the arches reform quite nicely.
Right.
This is considered a flexible flat foot.
Right.
Okay, these cases are usually pain-free. The children are usually pain-free until they reach an age where the tendo Achilles, the tight muscles at the back, the big muscles at the back start getting tight.
Wow, this is huge, man. I mean, so but it's harmless, right?
Generally, flexible flat feet are quite harmless. They don't give much problems in the long term.
Oh, okay.
But there's still something to take note of.
But just to clarify for a while, right? Like, how you know that you got flat feet? Like, my feet looks like there's a bit of an arch, but I don't know like whether it's bad or not. But when I walk far, I still feel tired.
I think to illustrate, we have picture here.
Right.
Maybe I get Dr. Lam to take over the house. What is wrong with this foot, Dr. Lam?
Okay, so I think this is a clinical photograph of a pretty young child.
Okay.
You can see. I think what Dr. Tony wanted to show on this photo is that the arch itself is pretty flat when you look at it from the side.
Okay.
So this part of the foot actually is supposed to have a nicer arch. Okay, so I think that's when children will start, or actually the parents or the grandparents will start noticing, hey, look, there's something wrong here. Why is he having a flat foot?
Okay.
Something like that in a very young child, I think, like we mentioned earlier, we need to assess is there's a flexible problem or is this a rigid problem? So flexible flat feet, if you ask this child to tiptoe at this point, okay, or if you just pull his big toe up in something what we call a Jack's test,
Okay.
we should see these arches reforming quite nicely. Okay, if they
You
do,
pull the big toe up.
yeah, that's right.
Okay.
Please not flex it, pull it up.
Oh.
Yeah.
Okay. I feel confident.
So this would be considered a flexible problem, flexible flat foot,
Okay.
which is less scary, more physiological.
Right.
But if on this test, the flat foot still looks very flat,
Okay.
okay, that means this problem is more rigid.
Okay.
A rigid flat foot can be caused by many other causes.
Okay.
Okay, we are thinking of things like structural abnormalities.
And that needs to be treated earlier.
And these usually need to be corrected somehow and somewhat. They
Okay.
don't just go away.
Let's say people with rigid flat feet,
Okay.
then not treated. What can happen?
So rigid flat feet tend to be very painful
Okay.
because there's less movement in certain parts of the
So like every step will hurt one. Or
they may not be every step,
okay.
but they generally complain a lot more of pain.
Can they run?
Yeah, they will still be able to run.
Can still run. Okay.
They'll still be able to run, they'll still be able to jump, but it may be more painful when they do these activities.
Okay.
Yeah, so pain is quite a predominant feature in patients who have rigid flat feet.
Okay.
What about, can they do like high level sports if they rigid flat foot not treated?
I think if the underlying problem is whatever is causing the rigidity, is it the tarsal coalition where the bones are abnormally joined, or whether there's any other neurological condition that's causing the foot to be stuck in that position, all these will have an impact on this child's development. So whether they can do sports or not, they can, but they probably won't be very good.
But would the shoes matter? Like there's some shoes that are made of flat feet, right?
Yes, yeah. So you're right. So if it's a flexible flat foot,
Yeah.
flexible flat foot can also cause pain.
Yeah.
All right, they will,
Yeah.
like I said, they stand, they run for long, they get a bit of aching.
Right.
So in these cases where the feet are flexible,
Yeah.
all you need is a orthosis or insole
Okay.
to help recreate the arch.
Oh.
And this helps to shift the pressure areas. And because it's so flexible, the foot arches are recreated very
Right.
easily.
Right.
The pain can be controlled.
Right,
In patients with rigid flat feet,
Okay.
okay, so the insoles sometimes actually cause more problems.
Ah, right.
Because now the foot itself is in a fixed position.
Yes.
You're trying to put something to force an arch.
Yes.
So now they're opposing each other.
Yes.
So commonly people with rigid flat feet, give them an insole, they actually complain of more pain.
Do you treat them surgically sometimes?
Yeah. So if it's a rigid flat feet, it needs to be investigated. So we need to find out what's the cause of it. So usually X-rays first, and if there's any MRI scans to determine whether there's a coalition of the foot.
a lot.
Yeah, and if it's truly rigid because the bones are abnormally joined at certain places, these you usually need to be addressed surgically.
I see. Wow, there's a lot about flat feet, and my brain feels flat at the moment. So, all right, we're coming back with more stuff about feet. Let's go. Let's talk about the next thing. We got
Intoeing and outtoeing.
outgoing. Toe in, toe out. I'm not sure what that's about. I'm not a doctor in this case, but we got two doctors with us, so they will talk to you more about it. Let's go.
Okay.
Intoeing like this.
Intoeing is like that. Outtoeing is like that.
Outtoeing like that. So the toes go outwards.
The foot.
The foot go outwards.
Yes.
Oh, okay. And what's that like about?
Is it also very common? More common than flat feet or less common than flat feet?
Intoeing is present to an extent in almost every child. It depends on what age you start walking. The earlier you start walking, the more likely the child will be intoeing
Why?
at that stage. Because when we are born, all our tibias are rotated. All our legs, our lower leg,
Okay.
they're all turned inward. And this is because of the way we are in the womb. We are wrapped up in this
Right.
for 9 months.
Right.
So when you come out, everybody's legs are still turned in quite a bit.
Okay.
And if you start walking early before the age of 1,
Yes.
it's more apparent because when you start walking, your legs haven't turned out yet.
Yes. Okay.
So this turning out procedure is something that happens.
And so, like, when does call for concern?
Intoeing?
Intoeing, yeah.
Intoeing is quite physiological. That means like I said, it happens in majority of people. It self-corrects along the way.
Naturally.
But what are the key things to think note of is if it is not symmetrical. That means one side turns in much more than the other, or turns up much more than the other. If the child clearly has delay in the developmental milestones, okay, ages that they are supposed to be walking, they are still much slower than their peers.
Right. Hey, doctor, can you tell all our viewers out there, right? What do we mean by physiological? All this while I've been thinking of it as like psychology. Like, did I get psycho attack? Then my feet get too into?
Right.
Yeah. So I don't want to understand. Like, what do we define as physiological?
Okay, so physiological is not psychological.
Right.
Two totally different.
Yeah.
Physiological, it refers to something that is normal, within normal limits, normal variation. So not every human is the same, you see.
Right.
But there's a variation. Like for example,
Yes.
talk about height.
Right.
Okay, so
Yeah.
not everybody is
The same height.
same height. Yeah. So
Yeah.
there's a variation which we say, look, this is normal.
Yes.
If you are too tall, then we say you are outside of the physiological norm. Maybe there's something else that's causing it. Let's find out what's causing it. Yeah.
Right. So there's all these like body shapes that can naturally be okay and healthy,
Exactly.
but this looks not the same as everyone else. And that's called physiological. The range of normality.
So in a situation where intoeing or outtoeing get the rotation,
Okay.
so that's when we talk about if there's something that is clearly out of the norm.
Yeah.
Let's say at a much older kid,
Okay.
8-year-old or 10-year-old, where most of them have already started correcting the intoeing,
Yes.
and they are still intoeing a lot.
Yes.
So clearly this child may be out of the norm.
Right. I
That's
see.
when we start thinking of other possibilities, want to investigate further.
Looks like intoeing sounds pretty normal as well. I mean, Dr. Tony, what's your take on this one?
I have friends who adult already, still walking like that, and I observe most of them are a bit obese. Is there correlation between obesity and
Intoeing?
no?
No.
No.
Oh, no.
No.
So there's no direct correlation between obesity and intoeing.
Okay.
Intoeing depends on which part of the limb is causing the intoeing.
Yeah.
Is it the feet? Is it the legs? Is it the hip bones?
Okay.
Okay, so there, like you mentioned, there are a lot of adults that are still intoeing.
Doing.
It is more common in, I guess, some cultures. like Japan. So you always see a lot of these Japanese ladies who actually into quite a lot. And I believe it's something to do with their culture because they like to sit kneeling.
Okay.
They did like a W position.
Yeah.
Yeah.
I see. So that affects.
That affects. Do they have problem when they into a lot, like after 7 or 8 years old or adulthood?
Yeah. So I've seen a lot of adults with intoing who run faster than me.
Wow.
Run much faster than me without any problems.
Okay.
So intoing itself is it doesn't cause arthritis. It doesn't cause hip or knee arthritis. It's different from, say, someone who is bow-legged. Yeah. So
Right.
they don't cause these problems. But intoing can sometimes cause frequent tripping.
Tripping.
They're younger, but somehow the adults, when you get older, you learn how to use your muscles a bit better.
Yes.
So they don't tend to get this tripping as much as when they were younger.
What about outgoing?
Yeah, so out-toeing is actually a much less common problem.
Okay.
This is because, like we said, physiologically, most kids are in-toeing since birth. And
Okay.
it naturally corrects slowly by the time they are 8, 10 years old.
Yeah.
So for a child to present with out-toeing is much less common. The majority of children that I see that present with out-toeing actually are flat-footed. So they are linked to our first problem that we talked about. Because when you are flat-footed, it pushes the arches down. Your feet naturally tilt outwards when your heel goes outwards.
Okay, out-toeing, flat foot. All right, hang on, guys. We need a break. So we'll come back with more information. Thank you so much. That was about, again, flat feet, in-toeing, out-toeing. Now to talk about tiptoeing. So what is,
Toe walking.
yeah, what is that?
Maybe I show some pictures.
Yeah, sure. Is it like a permanent condition or what? A temporary condition?
So tiptoe walking is a description of what we see,
Okay.
right? So the child is tiptoe. So it's not a diagnosis. The diagnosis needs to be assessed. We need to find out why is the child tiptoeing. Right?
You mean like all the way?
Also, it depends on what is causing the tiptoeing.
Yeah.
Majority of times, this is habitual. We call it a habitual toe walker, idiopathic toe walker.
What,
Idiopathic.
Oh.
Idiopathic is a medical term, which says that, which means that there is no underlying cause for it.
Basically, idiot. No cause ma. Idiots, yeah. But anyway, so it's like you mean they will tiptoe for how long? Then you say it's idiopathic concern.
Yeah. So for a child that has tiptoe walking, we need to exclude other causes first.
Okay.
Most common would be a neurological cause. That means something from the brain, something from the spine that could be causing it. Because
The brain tell them to tiptoe all the way.
No, because the brain and the spine actually controls our limb movements.
Okay.
So if there's anything that is causing that may have traumatized the brain
Okay.
during the development, it can lead to weakness of certain muscle groups
Okay.
or some muscle groups that are overpowering the others.
Okay.
Okay, and this results in a very typical or very exaggerated posture. Like that.
Okay.
Yeah.
So is it like, I mean, still they'll tiptoe all the way?
No, so you need to exclude all this. So if it's not if there's no underlying cause for this tiptoeing, usually this is caused by habitual. Habit is a habit.
But how can you do that?
Habitual toe walkers.
So tired, yeah.
It is quite tiring, right? You think about it.
On pressure.
Yeah, but if they feel tired, but why there is tendency to tiptoe?
So a lot of these these kids, when they first start walking, they're all experimenting. They don't know what's the best way to walk.
Okay.
Right? And we find that these habitual toe walkers, a lot of them actually are linked to the use of baby walkers.
Which walkers?
Yeah.
Why?
Because if you've seen how children in the baby walkers walk, they want to push off, they have to tiptoe to sort of push themselves to move forward.
Okay.
So it gets them walking. This is what gets them walking at the start. And they find that, look, it's a very efficient way of pushing myself forward. And because the child is still trying to figure out the world,
Yes.
to them, this is the best way of doing it. And they tiptoe, they can see more things also
I see.
at the table.
So it is not necessarily bad to walk tiptoe.
it's not a great position to be
No.
because you want to get them out of this habit.
Is it good to use baby walker for?
No, I don't usually recommend using baby walkers. So children will start walking
Okay.
when their brain is mature enough.
Okay. So
Yeah.
baby walkers is to force them to walk early.
Not really. I think
What is not good?
baby walkers are usually used more by parents because to keep them out of danger.
Right.
Because they're at the age where they are about to walk.
Okay.
And then if you leave them alone, they'll walk and they'll fall and they'll hit themselves.
Yeah.
So they put them in the walker, which
Right.
they can just toddle around and don't hit anything, you see.
Right. I'm not a parent yet, so I don't know about baby walkers. I don't even know how.
But I wouldn't advise it because it does make some of the kids develop the habit of tiptoe
Okay.
walking. Yeah.
So I mean, like tiptoeing itself, right? Even till now, I mean, like when they grow up, they will stop naturally, right?
Majority do stop
But
naturally.
it's so tiring.
Yeah, but
like
those
shouldn't be. But
so the parents get worried when the child hits about 3 years old and they still realize that they are still tiptoeing. Some of them.
Okay.
Yeah.
Is it still normal? 3 years old. What is the cutoff of normal?
Yeah. So most of tiptoe walkers will stop tiptoe walking between the age of 2 to 5.
okay.
Okay. But
Okay.
important is to make sure that the heel cord doesn't get too tight. Because if you're walking tiptoe or your whole childhood,
Yes.
even if you started off with normal muscles,
Okay.
your muscles at the back may become too tight by the time you reach 4 or 5 years old.
Okay.
And some of these patients, we find that they are unable to get their feet flat on the ground.
Okay.
Yeah.
Okay.
Just now you mentioned about neurological condition causing tiptoeing. Yeah. Example, what are
Cerebral palsy,
cerebral palsy?
spina bifida. Yeah.
What is cerebral palsy?
Cerebral palsy is a term used to describe basically a brain trauma, an injury or brain trauma in a developing child. So this can be in the womb or just around delivery,
Okay.
just after delivery. Commonly it's caused by like a poor oxygen flow.
Right. And they call it trauma in the brain.
Yeah.
Ooh.
What is the intervention for tiptoeing caused by cerebral palsy or spina bifida?
Okay.
Yeah.
So if it's due to something else like cerebral palsy or spina bifida, the problems are usually much more than just tiptoeing. Okay, so it affects all the lower limb muscles.
Yep. Yeah, you guys look at that, right?
So it will cause problems not just tiptoeing, but also even in the knees. The knees may start flexing too much. The hips may start flexing too much. So these need to be addressed later on. In the initial phase, treatments with therapy.
Okay.
Yeah, put them through lots of exercises, stretching,
Right.
strengthening.
Get the body back normal.
Yeah, and if that doesn't help, then we might need to move on to supports. If you have to walk, like certain splints here.
I see. Okay. Cool.
But last time I had a friend when I was in primary kindergarten or primary school.
Oh, you remember in the kindergarten?
Yeah, of course. I am normal. They wear something like Robocop bulky shoes and got a lot of steel and looks like very uncomfortable. Do you still use this kind of treatment?
I never see that though. What's that?
A kid wearing like steels until here. That
right.
boot, right? A boot.
What is that, doctor?
Yeah, so these braces or splints, like
Yes.
they are used in the past for quite a lot of conditions.
Okay.
And I think one of the common uses was in polio,
Okay.
which is
polio. Yeah.
non-existent now in
Okay.
Singapore.
Polio. Okay.
Yeah, because the muscles are weak
Right.
because of the virus.
Right.
They have to support their movement using some of these splints.
Ah.
Yeah, people used to use this also for conditions like bowing of the legs or
Oh, okay.
yeah.
But
certain
not for
deformities.
tiptoes, for
No, not
towing
for
or towing. No,
No, not for tiptoe walking.
I rarely see this.
Yeah, so
No.
tiptoe walking, essentially, if it's habitual,
Okay.
the treatment is usually stretches.
Therapy lah.
Therapy.
Yeah, and
Right.
you try to play certain games and certain exercises with the children.
Okay.
Practice again stretching the foot and putting the foot on the ground.
Right. I see.
So one of the common things is get them to walk uphill,
Okay.
like a slope.
Okay.
Yeah, because naturally it's very hard to walk uphill in tiptoes.
Right.
You will put the feet.
I see. Okay. Fine. That's pretty fair enough. That's pretty interesting. So, tiptoe less, walk uphill more is healthier for your legs. Thank you. Right, there's a lot about the feet, but right now, just for you, we've got 10 statements, myth or fact, with Dr. Lam Kai Yet. Now, Tony, let's go.
Dr. Lam, I will read 10 statements, then you just let us know whether this is fact or myth. And you can add a brief explanation, okay? Just brief explanation.
Brief, very brief, sure.
It's
Okay,
Doctor Say One Horh, by the way.
Number 1, footwear plays a critical role in your toddler's foot development. Fact or myth?
Well, I think it's true. All right. I usually recommend barefoot play for most children because barefoot helps with arch development up to the age of 7 years. But if you're going to wear shoes, you need to choose the shoes properly.
Number 2, wearing tight-fitting shoes can help correct foot deformities in toddlers. Fact or myth?
I think that's a myth.
Yeah, okay.
Yeah. So it depends on what deformities we're dealing with. But certainly wearing tight shoes is not the solution. Tight shoes just squeezes the feet into whatever the shape the shoe is. You may cause even more deformities.
Number 3, walking barefoot can strengthen a toddler's feet. Fact or myth?
Yes, I think we discussed this earlier.
Yeah, okay.
Absolutely true, yeah.
Shoes with arch support do not help flat feet in toddlers. Fact or myth?
Right.
Flat feet
So
in
feet
toddlers.
with arch supports, what they do is they recreate the arch when the child is walking. So a toddler is still developing the arch. Okay, so like I said, barefoot is still the best. And arch support at this point actually does not do much.
Okay.
It doesn't help the arches develop better.
Okay.
It doesn't give the child any athletic superiority in terms of running or jumping. This has been studied before.
Okay. Wearing shoes too early will prevent foot development.
Yeah, I think this leads back to the earlier questions.
Myth.
Yeah.
Okay,
Myth,
okay.
yeah.
Myth. So walking can be a sign of a serious condition.
Oh, it's true.
Yeah.
True, yeah.
Okay. Toddlers should be assessed for foot problems if they show signs of pain or difficulty walking. Myth or fact?
Fact.
Foot problems can affect a toddler's posture and balance.
I think it's true. Yes, our balance, our posture, actually everything starts at the feet.
At the feet, yeah.
Yeah.
So a lot of times you have feet problem, but the symptoms is in the spine.
Exactly.
I see a lot of those. Okay, number 9. If a toddler has a foot deformity, surgery is sometimes required.
It's fact.
Yep.
But the truth is it's really rare.
Yeah.
Really rare that you need to operate on a toddler.
Thanks for the reassurance, Dr. Lam. Number 10, the last one. Some foot deformities in toddlers are genetic. Fact or myth?
Actually, one of the most common it's true. So this is a fact. Yeah, one of the most
okay.
common examples is clubfoot.
All right.
Although there's no direct genetic mutation that has been found, but
But
Sure.
run in the family.
yeah, it runs a family exactly, like a mosaic or pattern. Yeah.
Okay. That's all my 10 statements.
Oh, that's all we have for you today, guys. Get ready to be blown away again by the next episode in the next topic, and you're about to love that one even more than today. But anyway, so before we go, as usual, guys, don't ever forget to
Like,
subscribe,
and
share this
share.
video to all your family and friends, and all that was found on Doctor
Say One Horh.